Hey there, Robbins. Good to connect with you. Congrats on all the success. Appreciate you making the time to get together today. I have some questions that I'd love to throw out at you about the relationship between SEMCAP Health and SafeRide. So to start, for the sake of our viewers, could you briefly explain what non-emergency medical transportation is and why these services are so important?
Hey, Craig. Yeah, good morning. Happy to. So NEMT, non-emergency medical transportation, is essentially the backbone for some of the nation's most vulnerable populations, specifically the Medicare Advantage and Managed Medicaid cohorts. I know in particular, those are cohorts that you're very familiar with. What we do is we restore access and dignity to care, which means creating that connective tissue for the nation's most vulnerable to access dialysis, wound care, chemotherapy, and then also some pretty scary stuff like methadone. And the way we do that is we have three pillars. So the first is we provide the actual transportation infrastructure, meaning a call center and services arm of the business for members to reach out to us. What we're seeing, which is pretty exciting, is many of our clients are actually now using our technology, which is the second pillar, to use their own services team to deliver the benefit. And then critically, all of that hangs in a network. So we go out and curate a network of medically qualified transportation companies, in addition to the rideshare companies, and also mass transit authorities, and provide gas card reimbursement to help these vulnerable populations access care.
So I know that we both care very much about addressing health equity and eliminating disparities. Could you comment briefly on what SafeRide does to really address those gaps?
Sure. It starts with our mission, which is to restore access and dignity to care. What we've seen is this is a legacy industry, and I'm sure you can share some of your experiences as well, that might have lost sight about the importance of creating a dignified experience, because that experience also translates into compliance to care. So when you serve, the life-sustaining programs like dialysis, wound care, chemotherapy, and behavioral health, you absolutely have to make sure that those members show up. And so what we do is really engage the conversation around health equity to provide the seamless member-facing experience to have them comply with their course of care.
Well, I think what you just summed up very much highlights sort of how we got connected and why I'm very interested in the work that you do. When I was the CEO of Blue Cross and Blue Shield of Minnesota, I witnessed firsthand what can go wrong when non-emergency medical transportation is not appropriately managed. You're doing what I wish other healthcare organizations were doing right now, which is to fix a broken part of the system that gets in the way of delivering accessible, equitable, and high-value care. That's why I wanted to be part of helping your business grow and achieve its full potential and impact. I've admittedly had a blast working with you after SEMCAP's investment on the various different levels that we work together, whether I'm helping to make introductions for you to C-suite leaders or new prospective clients, or consulting on strategy or assisting with team building. I see myself as a thought partner who can help bring perspective gained from my own experience as a health plan and health system CEO and leader with Fortune 50 healthcare companies.
We've grown really quickly. We've nearly doubled since you made an investment a year ago, and we plan on continuing to grow at that clip for the foreseeable future. So when we work with SEMCAP, we think about a couple things. The first is how do we learn from those who've gone before us? How do we think about going from a $100 million business to a $500 million business and leaning on various pools of expertise? So whether it be, hey, this is an operational business, you need to think through these 5 things because they're going to break, or the payer ecosystem is pretty small. Here's how we think about developing really targeted and deep relationships, and it's just thinking through each of these aspects and then finally creating a pool of advisors for our team. It's not only I who benefit from the relationship. You're bringing to bear advisors for my controller, my growth team, my operations team. You're helping me source my COO. And so thinking through the various ways in which SEMCAP can be a partner has really been appreciated.
Awesome. Thanks very much, Robbins, for all you're doing for the industry, but also for your partnership with with SEMCAP Health. We're overdue, I think, for a live get together. So hopefully we can do that soon. But really appreciate you making time today.
No problem at all. Good seeing you.